Hello, I'm Dr. Frank Barone with Evolv Plastic Surgery and Medical Aesthetics. There's lots of interest by patients in injectables. What are injectables? Well, that may be anything from Botox, which everybody recognizes, a medication to weaken hyperactive muscles in the face to improve appearance, or other types of volume injectables to restore the lost tissue that may occur with aging. You may have heard of Restylane or Juvederm. These are all what are called natural products because these products now, with technology, are biologically identical to what's in our bodies already. So there's really no antibody response to them. And that means better safety and more longevity with the products if they're used properly by a trained professional experienced with their use. Injectables can be used in many ways. Botox, for instance, as well as similar products called Xeomin or Dysport, are medications that weaken the hyperactivity of muscles. That can be used in the face for excessive facial lines, crow's feet, or the 11 scowl lines that make us look sometimes unhappy, even when we're not feeling unhappy, forehead lines, and bands in the neck. And when they're used properly, this restores a more relaxed, younger, and natural appearance to the face. When they're not used properly, they can reduce expression too much and give more of a blank look. So it's key how they're used and the training of someone who is injecting these products because they're very powerful medications. The other filler products, such as Juvederm, Restylane, and other similar products, are used to restore volume. As we age, often we lose volume in the face. It may be flattening in the cheeks or a hollowing look around the eyes. It may be loss of the fullness of our lips or deeper grooves around the side of the face and these creases. So these natural fillers, which again are biologically identical to what's already in our body, are used to restore the volume that we used to have. So used properly, they can give a natural look. Anytime an injectable product is noticeable, just like anytime surgery is noticeable, in my opinion, it's not a good result because the goal is not to make someone look different, but to make someone look naturally younger, consistent with their ethnicity, their age, and their sex. And when it's used in those ways, it's a very exciting and very gratifying procedure and quite safe. Yes, there are many applications for injectables, one of which is we can use Botox or Xeomin or Dysport, what are called neuromodulators, to reduce migraine headaches. Because research has shown that spasticity or hyperactivity in certain facial muscles can initiate a migraine headache. So if we can identify the source of this muscle contraction that's hyperactive, we can use Botox and similar medications, Xeomin and Dysport, to reduce that muscle contraction and cut off the trigger point that actually starts the migraine so someone can get up to 4 or even 5 months relief from these injections from their migraines, and that's quite exciting. In addition, fillers can be used to improve scarring in the face, as well as improve the signs of aging. So we've seen lots of applications for these fillers, and now that they're natural products, we feel the safety has been considerably better than in the past if they're used properly by an appropriately trained professional. I think it's extremely important to always ask who your provider is, what their training experience is, and what kind of credentials or qualifications do they have. Injectables are very popular. They're available just about anywhere, and legally just about any healthcare professional can do them. But stop and ask yourself, what kind of training does my provider have? What are their qualifications? And how much experience do they have? Because injectables can also cause complications if they're not used properly, such as infections with fillers, such as excessive side reactions with Botox. So we caution all patients to be careful about who's doing your injectables. Is it someone that just took a course over the weekend, or is it doing injectables just because they're popular? Or is it someone that's truly dedicated to aesthetics and has completed the appropriate licensing and training, such as a board-certified plastic surgeon or a board-certified dermatologist or a licensed nurse who has experience and has completed all the credentialing process. So we see complications with injectables just like we see complications in aesthetic or cosmetic surgery when it's done by those who are not adequately trained and credentialed. So please be careful and do your homework and check into the qualifications of your injectable or service provider.